It was about 2 years after graduating college and starting my career as a physical therapist at a hospital. A patient with incredibly strange symptoms was admitted, a 12-year-old, a fifth grader. He could barely stand, almost hanging onto his father's hand as he walked. At a glance, it looked like he had paralysis in his torso and limbs. Such paralysis is usually caused by nerve damage or muscle disease. Although my physical therapy experience wasn't extensive, I had my own philosophy, so I decided to assess the child my way. First, I evaluated and recorded his muscle strength, flexibility, and activity level. Then, I compiled a list of his symptoms and grasped his overall condition. Based on this, I considered the direct causes and prognosis of his functional impairment and established a comprehensive treatment plan. This is the basic procedure for physical therapy. As I meticulously recorded each detail, I felt a sense of pride and self-satisfaction, thinking I was doing quite well. Afterward, I reviewed his medical chart to gather more information about the patient. However, the chart contained unbelievable information. Surprisingly, there was no physical cause for his paralysis. While most paralysis stems from physical issues, this child's paralysis originated from an entirely different reason. The direct cause of his limb paralysis was a psychiatric issue, and the diagnosis was conversion disorder, a term I'd never heard before. It was utterly incomprehensible. How could paralysis occur with no visible physical abnormality? I couldn't help but admire the attending physician's judgment in immediately making such a diagnosis based on the patient's symptoms. We hadn't learned about such conditions in school. Frankly, there are likely almost no physical therapists in Korea with direct experience treating this type of patient. It was then that I first realized paralysis can occur even without a physical problem. Ultimately, because it wasn't the illness I had expected, the treatment plan I had vaguely laid out became meaningless. First, I had to find out what conversion disorder was. So, I asked a senior physical therapist who worked at the same hospital. He shared his detailed experiences with a conversion disorder patient he had treated previously. At that time, the patient suffered from quadriplegia and couldn't move at all. The paralysis was so severe that pressure sores developed. Pressure sores are a condition where tissue decays due to prolonged pressure on a body part, cutting off blood circulation. Through this, I learned that conversion disorder isn't just mimicking paralysis as a trick. It's a genuine physical symptom that patients themselves cannot control. Curiosity drove me to request the medical records of patients hospitalized with conversion disorder over the past 5 years from the hospital's medical records department. To my surprise, the charts I received belonged to over 90 patients. Reading through each chart, I couldn't hide my astonishment. So many patients had been hospitalized and treated under the diagnosis of conversion disorder. It was a much larger number than I had imagined. It was then that I realized once again, physical therapists truly need to know a lot and, therefore, must constantly study. After that, I began actively searching for information on conversion disorder. As it turned out, conversion disorder is a psychiatric condition where physical symptoms genuinely appear as an unconscious reaction to escape psychological pressure during extreme stress. In other words, the mind unconsciously creates symptoms like paralysis or pain as an avoidance mechanism to escape mental distress. Reading psychiatric books and papers was never easy. It was difficult to even grasp the precise meaning of specialized terminology, and I struggled greatly to understand the content in detail. During this time, I treated a psychiatrist who was hospitalized for back pain, and through him, I gained valuable insights into conversion disorder. Since conversion disorder wasn't a frequently encountered condition in clinical practice, relevant medical staff gathered for a meeting to ensure accurate assessment and appropriate treatment. We shared core treatment perspectives from our respective fields, coordinated necessary information, and collaborated to provide the best possible care for the patient. Since it was clearly a different disorder, the treatment approach also had to be different. To find appropriate treatment methods, I read countless papers and encountered foreign treatment cases. In the process, I organized the necessary information and developed my own treatment plan and methods. Initially, I made several mistakes without a clear direction. But gradually, as I realized what was needed, my treatment methods also improved little by little. For such patients, improvement is difficult to expect from the physical therapist's efforts alone. It must be managed through a team approach involving all medical staff. Fortunately, after 4 weeks of treatment, the patient's condition significantly improved, and they were discharged safely. And when the patient returned to the hospital a month after discharge, almost all their physical functions had recovered to near normal. At that moment, an indescribable sense of fulfillment washed over me. Coincidentally, over the next 6 months, about 4 more patients with conversion disorder were admitted and received treatment. Among them, some had walking impairments, and others were hospitalized with wry neck. Although not all were completely cured, these experiences allowed me to systematically organize the treatment methods for conversion disorder even further. I also had the opportunity to present on conversion disorder at a gathering of numerous physical therapists. Thanks to all these experiences, I felt my physical therapy capabilities had grown significantly. I still don't fully understand how psychological issues lead to physical symptoms. However, whenever I encounter such inexplicable symptoms, I realize that the human body is truly complex and wondrously profound. Honestly, even now, treating symptoms that are difficult to manage doesn't immediately appeal to me. But looking back at myself, gradually growing through the process of trying to solve challenging and perplexing problems, I can't help but think that this is also a special kind of happiness that only physical therapists can experience.